Hey guys, my name is Laura Koch, and I'm going to be presenting on botulism from Dr. Cody's Microbiology. Botulism, it's a neurotoxin that is made from Clostridium botulinum, which is the bacteria that it's the species of bacteria that's known. Its genus is Clostridium, and then its family is Clostridiaceae. Some details about Clostridium botulinum is that it's gram-positive. It's a bacillus-shaped, and it's motile, but most importantly, it is an obligate anaerobe. And that means that it has to be grown in strictly little to no oxygen requirements. Now, why is it dangerous? So, even though there's not that many cases worldwide anymore, it's actually quite a deadly toxin. It's actually one of the most deadly toxins known to man. It is a neurotoxin protein that prevents the release of the neurotransmitter acetylcholine from axon endings at the neuromuscular junction, causing paralysis. Botulism is known for its paralysis of the muscles, which can then lead to other complications. It has a very low lethal dose of about 1.3 to 2.1 nanograms per kilogram. It doesn't take very much to basically be fatal. Yet interestingly, it is actually used commercially to treat muscle spasms, and another very common use is Botox, the injections that you put into your face to tighten up the muscles. So currently, only about 5% of people die. You have about less than 5 people per 100 cases are dying. But about 50 years ago, before the widespread use of the antitoxin and stuff, about 50 per 100 died. That's about half. And that was only annually. Specifically, Clostridium botulinum has spores that help it to survive very extreme conditions. I mean, it can be boiled for a long time, and the spores will still last. But we'll see later on that it actually, with freezing, is a good prevention for it. Now, it doesn't usually cause illness in adults specifically, but when it does, it can be very deadly. Now, some historical facts about this disease. It was first recorded in 1735, where the disease was actually associated to the consumption of sausage. I'm sure that back then it was also in other foods, but they saw that people who ate sausage would contract this disease. Now, it wasn't actually until 1870 that John Mueller, a German physician, coined the term botulism from the Latin word for sausage. Yet, about 20 years later, it was the time about 1897 when Emil von Ermingen, he actually linked botulism to the bacterium Clostridium botulinum. And then more recently, in 2015, there were about 199 cases of botulism that year. About 39 were foodborne. Surprisingly, 141 were infant, and 15 were wound-borne, and then the 4 were unknown or other reasons. Now, prevalence of about today, it dropped to about 1,000 cases worldwide, and that's annually about now. But in Ontario, from 2006 to 2016, there's an average of 3 confirmed cases per year. On January 11th of 1991 was the most recent botulism outbreak in Ontario. And in 1990 to 2000, specifically in the U.S., 160 incidents were recorded that affected 263 people. That's about 1.1 per million per year. So how do you get the disease? Well, it's not spread from person to person. It's actually, typically you ingest it, or you inhale it, or you are injected with it. And ingestion is the most common form of contracting the disease. Now, there are about 5 types. There's foodborne, wound-borne, infant, adult intestinal colonization, botulism, and then there's iatrogenic. Infant is the most prevalent and the most typical, but foodborne is probably the easiest and most widely known. So for foodborne, you can get it from inadequately canning at home or lightly preserved food. For wound botulism, basically some contaminated soil or some gravel can get into your open cuts. For infants, they don't have the proper immune system or microbes in their intestine to fight off the toxin being secreted by this bacterium. And then for adults who have abnormal intestinal or bowel conditions such as colitis or intestinal bypass procedures, or just conditions that make you have lower amounts of microbes to fight off these new microbes, can get it. And iatrogenic is Botox injection. So basically, if it's an improper amount of Botox, you can contract the disease. So in order to actually get this, you would have to have little to no oxygen to germinate in the intestines. And then once that bacterium has the ripe conditions where it's like low acid, low sugar, low oxygen, it has to be the right temperature, it will germinate and secrete the actual toxin known as botulism. Now, one can contract this, as discussed, via ingestion, inhalation, or injection. Foodborne botulism symptoms specifically, they appear about 12 to 36 hours after eating a contaminated food. But they can occur as early as 6 hours and as late as 10 days. So these symptoms, for a typical food or wound botulism, you would see double vision, blurred vision, the drooping eyelids, which is kind of the hallmark of the disease, slurred speech, difficulty swallowing, dry mouth, muscle weakness, and you also have flaccid symmetric descending paralysis, which is kind of in the later stages, and it's also what botulism is known for, vomiting, diarrhea, and constipation. Specifically for babies, you would have they would appear lethargic, they would feed poorly, they would be constipated, have a weak cry, and they would have poor muscle tone. As you can see in the bottom right, you have someone picking up a baby, but they can't keep their head up because they don't have muscle tone. And in the other two pictures, it's the drooping eyelids because of the early onset paralysis. In order to diagnose these, a doctor would typically analyze the symptoms. And if the symptoms are botulism-like, they would run tests to rule out botulism-like diseases such as stroke, or myasthenia gravis, or Guillain-Barré syndrome. Sometimes botulism can actually be very difficult to diagnose because people will think that it's one of those three instead. They can also do brain scans, they can do spinal fluid examination, and nerve conjunction tests. But the most common thing that they do is they identify the toxins in the stool of the infected. Now, treatment. There are a couple different ways of treatment, and it depends on how long you've been exposed. So specifically for foodborne and wound botulism, you have botulism antitoxin for the early diagnosis, which prevents any further damage to your nerve cells. Doctors will actually sometimes induce vomiting or diarrhea to clear your GI tract of whatever bacteria is in there. But the antitoxin cannot repair the damage that has been done already. Now, for late diagnosis, you have mechanical ventilation and IV fluids, or antibiotics, but that's for wound botulism only. And then you have rehabilitation, because sometimes you have to learn to walk again, or you have shortness of breath for years, or other complications. For wounds, they are treated surgically to remove the bacteria and the toxin. Now, who's at risk and what actually kills you? So people at risk are going to be heroin or other drug addicts. You have the people who homebrew beers or alcohol, and the people who can their own foods. And then you have the Botox users. Those are the three main people that are probably going to be needing to worry if not done properly or other things. And what actually kills you is a respiratory failure due to the muscle paralysis of your respiratory muscles. You can't breathe anymore on your own, and people die from that. Now, in order to prevent this disease in the future, you can practice safe and sterile canning at home or brewing. When you can things, you should probably boil them for 10 minutes to be safe, to kill all the bacteria. Don't feed honey or corn syrup to children under 12 months. And as I said earlier, freezing food, because Clostridium botulism cannot survive for under those temperatures. Having low moisture conditions, and then high oxygen because it's an obligate anaerobe. Thanks for watching. These are my works cited.